Hello and welcome to another episode of our podcast DHIL with 4 in the middle, Digital Health Innovations for Long Life. Today we have with us Dr. Venkat. He is a professor of supply chain management and logistics at IIM Lucknow. And we will ask him straight away about where he was born, how he got interested in healthcare management, trace his career, and ask him questions about digital health, the present and also the future. Welcome to our podcast, Dr. Venkat.
Thank you, Dr. Suresh. It's a pleasure meeting you on this occasion, and it's my pleasure to take forward about my journey. I basically come from a small village near Saddikuti, which is close to Tirupati temple town in Andhra Pradesh, and I come from agriculture family. And I'm basically, by qualification, I'm a mechanical engineer and industrial engineering PG and PhD in operations and supply chain management. And
if I may ask the so-called uncomfortable question, which is, when were you born, sir?
Okay, 66 August.
Okay.
So I'm 59 now.
So. Well, that's kind of a little bit more than a decade before me. So I was born in 78, though.
Wow. Nice.
So where did you do your schooling? I mean,
schooling again, I always say that I studied under a single teacher school from a rural village school from first standard to fifth standard, one teacher. And after that, nearby high school, and then from there, Saddikuti town for my plus 1, plus 2, and then Venkateshwara University, mechanical engineering. Then NIT.
And this was in which year, the bachelor's in engineering?
Bachelor's engineering is 85, 89, and 1991 is my MTech, and then I joined Guindy Engineering College, a very prestigious institute of this country, as a lecturer in industrial engineering. Then I also did my PhD, and while doing my PhD, I stayed at IIM Bangalore in a research project. That was the most important turning point in my academic career.
So I too have a small connection with the Guindy Engineering College. My sister studied there, and it was my weekly job to pick her up on Friday and then drop her on a Monday morning. So I did that for a few years, I guess.
Yeah.
So you did your PhD, and then when was your first job, Dr. Venkat?
My first job was in 1991 itself. I started my teaching career at NIT Calicut, teaching on drawing and allied subjects. Then I joined a permanent position at Guindy Engineering College, Anna University, Chennai. Then I completed my PhD and joined Honeywell, Singapore as a supply chain management lead engineer in the research labs. Then subsequently, I shifted my job to postdoctoral fellowship at Singapore MIT Alliance program and Nanyang Business School, Nanyang Technological University.
And again, this was in which year?
Again, it was 2001 and 2.
Okay, so the dot-com
boom, yes.
The boom or the bust?
The dot-com bust, yeah.
Yeah. Again, Calicut, I think, is a wonderful place. Fantastic food. How did you shift back to Chennai then?
That was the education purpose. I went to NIT Calicut, but for job-wise, I came to Chennai.
So you did your postdoc in Singapore?
Yes, Singapore MIT Alliance program.
And then what happens next?
Then I came back to IIT Madras as a assistant professor in manufacturing engineering section. Then due to my association with IIM Bangalore as well as Nanyang Business School, I thought IIM platform is much powerful than IIT platform. So that made me to shift to Madhya Pradesh, IIM Indore. So there I did all that is possible for about 8 years. At Indore, I got wonderful opportunity for taking up a Fulbright fellowship, and as well as some training at Harvard Business School. And we also did a few things. A very unique program of this country is a 5-year integrated program in management. That was the very unique program in the entire country, which was started at IIM Indore. way back in 2011. At that time, IIM Ahmedabad Professor Ravichandran was the director. He is known for his very, I would say, unique kind of experiments in the profession. So I was part of that exercise and I thoroughly enjoyed that. At the same time, I also got this Fulbright, and that Fulbright was the turning point for my healthcare research.
Okay. You mentioned that IIM platform is better than IIT platform. I think I will not get into your debate because,
Of course.
unfortunately, I haven't been to either one of them.
Yeah.
But what is your focus? I mean, what actually interested you, or what caught your attention in Bangalore or in any of these IIMs?
Yes. So I was doing my PhD at Guinea. Then I was looking. The topic that I selected was the real life problem.
Okay.
So in that context, I got a research associateship at IIM Bangalore, which was supposed to be working with the industry on the research problem.
Okay.
So that made me to learn something from IIM.
Can you explain what the problem was?
The problem was plant layout problem.
Okay.
It's a modeling.
Okay.
So how do you improve the flow? Basically, if I put it in a nutshell, it's a flow optimization for manufacturing sector.
Okay.
So that made my life easy. And the way I can still tell about the difference between IIT and IIM. IIM is like a customized ship.
Okay.
IIT is a very big ship.
Like
Yeah. Okay. So the managing this smaller or medium size is much better. Agility is there. In IIM system, there is a lot of agility. They will change things very what is required, and they are much more closer to the reality than.
Is it because people in management have to report quarterly and they allow to, as you said,
I would say it's a more output driven than any other.
That's true. That's true.
The management institutions are much more output driven than other institutions. It's like a medical field, I would say.
I mean, well, here every patient or every so-called touch point makes a huge difference.
Absolutely.
So, you took a Fulbright fellowship and then you went to Harvard?
I went to Arizona State University for Fulbright. And the same year, I also got opportunity on the participant-centered learning workshops and training at Harvard.
Okay. And you mentioned that that was again your first maybe focus or probably your interest in healthcare. So again,
Yes.
if you can please explain how you got interested.
I focus more, almost every day newspaper reading is my hobby. And that too, technology, science, and thanks to Hindu. And there is a special section called the science and technology kind of thing. So in Madhya Pradesh, the access to Hindu is very difficult. So next close to that Hindu is Hindustan Times.
Okay.
The Hindustan Times paper there was a profile of the one of the founders of a medical device company, medical equipment and medical device company called Sleep Electronics.
Okay.
So I read that and then went to the office, and then from there I went to this company and said I want to learn more about this. In the same year I was applying for Fulbright. This problem context became the proposal for my Fulbright.
Okay.
So I got that, and then from there is non-stoppable journey. So medical device supply chain.
Okay.
So that is the most affordable medical device in terms of the pacemaker. So even today that is the world's most affordable pacemaker. So that was the beginning learning point for me. And then went to Arizona State University and did further research on that and multiple other things. Then that was the time I looked at our wonderful model called Arvind Eye Hospital model.
Okay.
So then I started working on that from 2010 onwards. And subsequently, I shifted my base from Indore to IIM Lucknow, basically to work closely with the healthcare organizations like hospitals and other organizations. And while I was at IIM Lucknow, I had a health incident in my family. My son got hospitalized due to dengue fever in Hyderabad.
Oh.
That time it was just a 3-day hospitalization observation. It's almost costed more than 3 lakh rupees. And it was eye-opener for me that, it is a high time that I should address some of these things in my profession. So I opted to offer an elective on healthcare management.
Okay.
I can say it is a very unique course in the entire country, in IIM system particularly, where MBA students will have a formal healthcare management course. So far so good. It's almost 10 plus years.
Oh.
It's running very well.
Fantastic.
So I thank all my students and the industry support. And more than all these things, my institute support is phenomenal. So I've been doing that, and we have also offered, or is also an offer, the industry-based program. Healthcare executives also join a program, and we have a almost 1 year long program, both online and offline combination.
Okay.
So wherein both doctors, super specialists, and non-doctors, healthcare professionals also join this program. So we, at least myself and a couple of other people, are focusing on healthcare research, training, and education programs.
Well, we will come back and then discuss a little bit more about your program. But thank you for visiting us. You are here at Mallareddy Vishwavidyapith, where we have started India's first school of digital health, and we are also offering bachelor's, master's, PhD program in digital health, medical robotics, immersive technologies, and also wearable devices. And most of them are actually the first in the country. In your opinion, what do you kind of imagine as digital health? Not something that is happening now, but the future as a potential of digital health 5 years, 10 years from now. And maybe even the project that you actually mentioned about optimization of a shop floor or optimization of a factory. I think recently there was news that when so-called Teslas or probably even Xiaomi actually builds a factory, it's got very few people, and almost all the factory is completely simulated as a digital twin first and literally laid out, and then it just starts working. So digital technologies have changed a lot of things, but in your imagination and partly linked to reality, what do you think of as digital health?
See, the digital health per se, or digital technologies in healthcare segment, is basically to cut down the cost or the waste in any form of waste, so that you are able to respond as well as in terms of time and also the cost part. Both affordability and the responsiveness, I call it as, is possible by using digital platforms. And another very important dimension is the most important element of digital across any field is how to make non-customer as your customer. Non-customer as the customer. Someone, let us say in healthcare, I'm not the customer to an healthcare organization or healthcare service provider, because there are a lot of barriers. So how do I access and consume the healthcare services? Through digital, it is very much possible, and real time as well as the ultra low cost is also possible. That's what we could see during COVID time. And we have also written a small article around that, that is COVID-19 is a prescription for change. We left it with a question mark. So what I could see in digital now with respect to healthcare is that in future, it's not only addressing the delivery part, it can also help in a very big way to predict very, very well in advance.
Yes.
For example, cancer care. By observing the health parameters on a regular basis or whatever it is, including the hereditary kind of situations, etc., the early detection is possible. So I would link this to 3D model of healthcare delivery: diagnosis, doctor, and drug. So this diagnosis can make a lot of things very easy. If you address at right time, you can address with 1 rupee. If it is a prevention level, if it is cross that limit, then the ability to address and the cost to address the healthcare is very, very huge. So the early detection, early treatment, these are going to change the way things are happening, particularly for India.
That's a fantastic explanation. In fact, I'll try to connect your rather very interesting description of converting a non-customer into a customer with early detection. The way that we think digital health is 3 R's: rapid, reliable, and repeatable. And all these 3 things are possible only if the cost actually comes less. Otherwise, if it is very expensive, I don't think repeatability is even a possibility at all. And if it is again very expensive, rapid or not, nobody is actually going to do. But when you say that a non-customer is going to be a customer, the way that we think digital health is going to make a difference is presently the so-called positive health elements are not actually being addressed. The way healthcare is seen is it starts at a hospital. So most of the focus is on diseases, treatment, management, and as you rightly said, the whole area of everybody understands that prevention is better than cure, but there's actually no platform for prevention. So if healthcare also gets into prevention, and these are all presently non-customers. So if we can push healthcare into these areas, that would be fantastic for several reasons. One is it prevents the disease, helps the people to live longer, and also it reduces the burden of disease itself, reduces the burden of care, and as you rightly said, it also reduces the burden of cost also for several people who I think unfortunately suffer from the expensive healthcare that most countries do have to offer. But if you can be a little bit more specific, at least given your expertise into supply chain and logistics, I think these are, at least in my opinion, 2 interchangeable words, but I'm sure as an expert, you can probably have a different opinion. What are the specific challenges of healthcare, largely in general, but more specific in the area of supply chain or logistics?
Okay. So I'll give 2 parts to it. The first is before supply chain comes into picture. Since you mentioned healthcare and disease management, I recall what Dr. Devi Shetty said at one point in time, that what we are managing is we are creating, or rather we are not addressing the health part, but we are addressing the disease management. Hospitals, what we are managing in the hospital is not the health, it is the disease. How to prevent disease occurrence is most important. So, the awareness is the key. The people, what they are doing, what they are eating, what they are thinking about health. Everybody thinks that I am perfectly fine. I can eat anything, I can do anything. So people know that what they should not do. For example, I tell you, someone who is having a pre-diabetic, they relax their food habit and then once in a while they take sweet, and that too, the sweet in India is the sweetest of the world.
Yes.
So we have to control our tongue first and mindset. And there should be someone to tell these things. I even told students that listen to your mother and eat what your mother gives, what you get from outside. So that wellness part has to be individual responsibility. A good education can help on this. Repeated health education should be made compulsory across the schools, particularly. Children should be told what makes their health. In every other country it is there. For example, in Singapore, the school children makes their parents to learn what is a healthy practice. For example, I'll tell you, during these communicable diseases particularly, there was early 2000 when we were in Singapore, that was SARS was a very deadly kind of thing. The children were told in the class schools as low as LKG and first standard kind of thing. What is the way to wash your hands? It is like this. So they were shown and there was a demonstration for the children. So catch them young. Schools should introduce preventive health care. I think it's my request to all the education ministers of this country to include kind of awareness program at the schools level, the school children should go and take their families to follow the health practices.
There's also one more policy in Singapore where they prevent any kind of a water stagnation, and even if it is more than 5 millimeters, and that's
Correct.
even so small,
Correct.
industries are actually fined. And that has actually stopped malaria, chikungunya, dengue in Singapore because there is no fresh water for malaria mosquitoes to breed. And even if you have what you call a small plant where you water regularly and if there is water stagnation, you are actually fined. Compare it with our country where you see water stagnation every year. Of course, malaria is also everywhere along with chikungunya and dengue. Yeah, so perfectly agree that healthcare as an education, as a regular continuous education should probably start very early.
I'll add one more point to this. Education and the community participation
Yes.
is a community-led movement. It's like something like Swachh Bharat. I really appreciate our Honorable Prime Minister's brainchild, Swachh Bharat. I think if there was no Swachh Bharat, this country disease burden would have increased like anything. So the community participation and community engagement is very crucial for preventive care and health and wellness.
And again, these things should potentially be introduced at school itself, where every class cleans up their own school or probably goes around. I think this used to happen a long time ago, but now with all the crowded cities, it's becoming extremely challenging.
And all the more we need.
We need all the more, but I think the challenge is not in the ideation in our country, but always in the execution part.
Execution and the adherence.
Yes. Even doing it once, I mean, we can broadly say, walk on the left side of the road, but then we also need to have pathways.
Yes.
So that's where the...
I'll add the second part of logistics and supply chain.
Yes, please.
We did the field-based survey project at KGMU Lucknow way back in 2015-16. And in fact, Trauma Care Center, doctor was also our collaborator. And we happened to be AIMS Bhopal director subsequently. What we found was the awareness and the infrastructure, particularly emergency care infrastructure in terms of the patient transport. Any vehicle will be an ambulance, including a two-wheeler. So, out of 100 plus cases that we have studied, only 2 cases 108 was engaged. Only 2 cases. In Lucknow, in and around Lucknow, that too. So the KGMU Lucknow happened to be the country's largest public sector hospital. So what we need is the emergency care infrastructure is very important. The second part of this, the people who are involved in shifting the patient from the accident site to any hospital, that first 10 minutes we call platinum 10 minutes or golden hour. They should know where to go or where not to go. They take the patient to the nearest nursing home. They will, they have a fear of, people attacking.
Sometimes it's
people attacking them if they don't address.
And then they can't
they will address. This is where the hospital safety, doctor safety comes into picture. So, the time they address this issue and then send them to the right hospital, they lost the valuable time.
Yes.
So the decision making on the spot decision making is very, very important. So if they take the patient to the right location, so a lot of casualties can be avoided. So my one possible solution for this is we should increase the ambulance infrastructure particularly, and also the education level of these staff, so that they know from the accident side what is the nearest hospital that can address. Not every hospital can address the emergencies.
I think this can also be tied to your previous comment. At least some kind of emergency response care should be inculcated into every student or probably in every walks of life, because that's extremely critical and very important. The second challenge is, although we need to have ambulances and the emergency infrastructure, when your basic infrastructure is challenged, in my personal opinion, adding up an additional layer to it is not going to be that successful. So if you have 3 lanes of road or 4 lanes of road, you can reserve one for emergency. But if you have 1 lane of road that's completely crowded,
it's not possible.
An ambulance is going to be, endlessly turning on a siren, and there's literally no way to go.
I'll add one more point to this. Of course, our National Highways Authority, Highway Authority of India and Transport Minister said several times that for every 50 to 100 kilometers, there should be a emergency response clinics kind of thing. Of course, in many highways it is there. In fact, I have visited few of them in and around Hyderabad, ring roads and other places. I think what we need is the response systems in place.
A few years before, we actually did I wouldn't call it as a very detailed study, but identified the healthcare locations from Hyderabad to Bangalore and Hyderabad to Vijayawada, these 2 sites. And we found out that literally once you cross, I think, teaching hospital on the outskirts of Hyderabad towards Vijayawada, there's actually no healthcare facility. So any accident happening either goes to a district hospital, and as you rightly said, they may or may not actually be equipped to handle, although it's a fairly tertiary district hospital. So most of them have to go either to Vijayawada or to Hyderabad, and you are actually beyond your so-called golden hour. Actually, it takes more than an hour. And the same thing on the Bangalore highway. The problem is sometimes district hospitals could be close by, but as you rightly said, nobody knows where the district hospitals are. There's not even a signboard which says, there's a hospital 20 kilometers away. So people start rushing to both sides, and then you actually add up 2 or 3 more hours also. So
yeah, I want to add my opinion on this, particularly on the national highways and the state highways. Instead of promoting commercial places and other stuff, we should have the health facilities around these places, where the happening places. Yeah. Like for example, we have a cine complex, the malls. What is wrong in having a 1 floor dedicated for a public hospital inside the mall? It's a quite
malls are accessible, so healthcare has access issues, so I think it makes sense.
Yes.
Well, I think we need to probably start publishing it and hope that it actually reaches the so-called right eyes and ears at some point in time.
Yes. So I would say that these things are happening, but the scale at which it is happening can be much faster.
Yeah. The other challenge is also the fact that India is the world's most populous country at 1.4 or more billion people. And that actually puts everything into a perspective. So even whatever we try to do, there's always 10x, 100x times that is actually necessary. There's a lot of changes that are actually happening in healthcare, a lot of investment that is actually going in healthcare. Where does all this money go?
Very interesting. The healthcare industry is completely different from any other business sector. If you put money in a car manufacturing plant, that can be scaled up and the cost reduction can happen much faster. Because there is a non-linear economics. Instead of producing 100 cars, you produce 100,000 cars, the cost per car will go down drastically. But that is not the case with medical care or health care. A doctor can increase their productivity from, let us say, 20 people a month to 25 or max 30. So this non-linear economics is not that easy in healthcare, particularly the human resource cost. That's number one. Number two, the technology cost is very high because there is a kind of monopoly in the equipment, devices, pharma, labs. There are minimal number of players because the R&D costs and the cost of running these businesses are much, much higher. You will find so many number of other companies, but not medical devices, medical equipment or pharma companies. If you take a cancer drug, a specific cancer drug, you will only find one company in the world which is manufacturing that particular drug, which nobody else can produce. This is my fundamental question that I ask my students. Every other product and service cost is going down, but not the healthcare cost. So the reason is is a market dynamics are completely different in this case. So the someone who has put in their money, they want to get back their money. That is the fundamental thing in any business.
But these apply to patented medicines or probably the so-called cutting-edge technologies. On the other side, if you look at our country, and unfortunately, India has several unique challenges of its own. Even availability of off-patent, very regular medications, even something as simple as paracetamol, decent quality paracetamol, is an extremely challenging issue in our country. How can we address this?
Yes, you have touched the the kind of DNA of the business. Fix your supply chains.
Yes.
You have to ensure the drug availability at the place where it is required. I would take the reference of Tamil Nadu Medical Supply Corporation model, TNMSC model popularly known. The situation in Tamil Nadu at one point in time was very horrible. Early 90s, an IAS officer from state government and a private player, a software company with credentials, extraordinary credentials of supply chain, has put this system in place. And in fact, that model is WHO's standard model both for country and outside the country. So every state and even at a hospital level, it is a private or public hospital level. So you should maintain this simple inventory management principles. People don't have an idea about this. So you have to put right people on that. I'll quote one non-Indian example. There was a children's hospital that we visited in Copenhagen, Denmark. The first employee of that new hospital was a logistics manager from Coca-Cola. The logistics manager was the first employee of the new setup. If you fix the logistics within the organization and outside the organization, this problem can be addressed.
But the question is, how do we fix it?
Yes, there are models, and particularly for India, I'll quote two models. One is a state public health model, Tamil Nadu model, Tamil Nadu Medical Supply Corporation model, fondly known as the TNMSC model. And for hospital level and otherwise also Arvind model, and close to that is the Narayana Health. They have a separate supply chain management department. It is run by a medical doctor with the support of the non-medical people also. So I strongly recommend, it's like any other business, there should be a separate supply chain management department who is responsible for these things.
And all three examples that you give, unfortunately, are from the southern part of the country.
Wonderful.
Which is fantastic. But also the southern part of the country, especially Tamil Nadu, Kerala and Karnataka, already have very good roads, very good infrastructure, and then the administration works very well. But as we slowly keep moving up north, I see that the challenges again dramatically increase. Tamil Nadu, I think I read a recent article which said that 20% of all registered industries are in Tamil Nadu. So that's almost 1/5 of the industries are in one state, versus 29 other states share the remaining 4/5. So as we slowly go up, the moment you are halfway into Andhra, get into Orissa, things change drastically or even very dramatically. In fact, when I keep driving, I hardly see any passenger vehicles. It's only usually trucks, and it's even scary to stop on the highway, and literally very little is actually available. But this is also places where people unfortunately suffer from a lot of healthcare conditions. So relatively speaking, as we go up north, the more and more communicable diseases still addressed, not yet addressed. So how do we improve supply chain in these locations?
Very good. I completely agree with you. This is what I call it as north-south gap. It is not only true at the country level, it is true at the state level. You take even a village, as simple as a village. One side of the village or one part of the village will be well developed compared to the other side of the village. This is natural. Only way to do this is adopt the best practices. What is proven solutions in one part of the country can be adopted other part of the country with a local level customization. This is what I call it as. There is nothing called a perfect one size fit all. So for example, we worked with the UP government, UP Health Department, particularly for that matter. The founding MD of UP Medical Supply Corporation was IAS officer, who was with whom we worked very closely in understanding the Tamil Nadu model and then taking these Tamil Nadu best practices to design the UP medical system. The question is, Tamil Nadu is 1/5 of UP.
Yes.
It's as simple as, how do we forecast the medicine requirement for UP to start with? After you start, then things will become better. To start with, which model should be the reference model for you? So to that level, you have to see your budget, you have to see the availability, you have to see all those things. I would say, customize your medical supply chains to UP, then slowly you can improve. So continuous improvement is the only one of the possible mechanisms to do that. I think the last few years, in my personal experience and what I have been seeing in, let us say, Tamil Nadu versus UP, UP progress is considerably significant. But still, we need a long way to go.
Probably they're starting from a small base.
Yes. I'll add one more point. The financial support from the government, particularly for public, and the leadership. The right leadership and the right executor, like for example, the MD of UP Medical, or that system is very important. So we know a little bit what is happening, and I think our country is learning from one state to another state in terms of best practices.
Yeah, that's true. I mean,
yes, we are learning very fast. Yeah, I must appreciate that.
There's, to compare ourselves to another country is extremely challenging, whereas comparing state-wise, I think, is much easier also and much more relevant also.
Yes.
On the other side, there are e-commerce companies which are promising 10-minute delivery, at least in urban areas, again, in most of the state capitals at least. And the e-commerce companies almost deliver throughout the country, even in far-off areas in Assam, Arunachal Pradesh. In fact, like even if you go to places like Andaman Nicobar, they are like wholly dependent on these e-commerce companies. So on one side, supply chain is actually improving. On the other side, especially when it comes to healthcare, there are challenges and there are still a long way to go. In your opinion, if you want to change a few things specifically in healthcare supply chain,
yes,
and add digitization to it, as you rightly said, it probably reduces the cost, it maybe reduces the time also, hopefully. What are the 2 or 3 things that you would actually want to focus
Wonderful. On? One is just technology will not be sufficient.
Yes.
And managing and developing these technologies by public organizations are not easy. Public organizations are not meant for developing technologies. Public organizations are meant for delivery and policy and ensuring that these kind of services have been delivered properly. So in this process, what we need is, particularly in healthcare, for example, now when you talk about digital health, there are a lot of startups which are coming forward to make sure that these things are happening. I would call it as public-private partnership and collaboration. So even we called, named our workshop as the collaborative innovation. So the like-minded or the complementary organizations should come together and then develop this. I would go one step ahead. Now, due to advent of these digital technologies, the healthcare is in the hands of the software companies and the logistics companies. Like for example, Blinkit, as you rightly said. I'm very happy to see Venkat has got into the emergency, patient transport, ambulance services. As an excellent move. We need more such kind of players into this. And I am seeing that the drones is a big thing.
Yes.
So the drone company can be owned by a private startup, and maybe other infrastructure base can be shared that. So institutions like IITs and IIMs or even private institutions can become a hub or a local small hub for these kind of deliveries, like dark stores in e-commerce.
Yes.
So the e-commerce supply chain can be customized to the healthcare supply chain.
And I think next year or another 1 or 2 years, there are these larger UAVs that are actually coming in, advanced air mobility, which can lift up to 2 to 5 people and travel up to 200 to 500 kilometers. I think the initial rollout would be from city to airport, but then what we are also discussing with Niti Aayog and World Economic Forum is there is a challenge of skills in district hospitals where most of the doctors want to come back home the same day, live in urban areas. But if we have this mini helicopter type of things that can go and then come back, so more and more healthcare can be shifted to district hospitals. But this can also help with all the other requirements. It's not just a doctor, but a complete ecosystem that is actually necessary.
Yes.
And a lot of these things can actually be shifted. So better supply chain, at least in our opinion, equates to better healthcare. And that's, as you rightly said, I think fundamental for all healthcare.
I'll add my observation here. India is a fascinating country, there's no doubt. In India, we have a record of organ transplant from Delhi to Chennai or Bangalore to Chennai and even Hyderabad hospitals. The organs have been harvested and shifted in less than 1 hour or even close to 1 hour kind of thing. These green corridors worked very well, and the collaboration and coordination with the the stakeholders who are involved. For example, the police.
Yeah.
When there was a heart flow, flown from Bangalore to Chennai, from Chennai airport to hospital, the way the police, contingent or the police infrastructure worked to make sure that is reached has happened in a very, very excellent way. So we have such kind of wonderful achievements. I think if that thing can be put in place, I think, the organs available in this country can be floated from one part of the country to other part of the country. For all these things, efficient and responsive logistics is the key.
That's true. Absolutely.
Yes.
Well, I think now we'll have to go back to where we paused, which is the program that you are actually running in IIM Lucknow with regard to healthcare. As I mentioned, we have started India's first school of digital health. So broadly, 2 questions. One is, there's a lot of change that is actually happening in the name of digital health. What do we start teaching our new students, especially bachelor's, master's students, who are literally coming out of the school environment? And as you rightly said, all these ideas at a very early stage or relatively early stage is actually really good. So what do we teach? Is there anything that we can hopefully copy or at least follow what you are doing at IIM Lucknow that we can also kind of incorporate here? So what do we actually teach and how do we do it?
Yes. See, as I mentioned that out of my own personal episode of healthcare made me to offer this course, I take this course as a basic awareness as a professional that what is that we can adapt from one area of the business to the healthcare.
Yes.
My course specifically, I named it as healthcare operations management. I focus on 3-4 things. One of them is digital. Another is operations excellence and lean and supply chain. So we have wonderful examples of well-proven supply chain management practices. How do we customize these principles and practices, including technology, etc., to deliver acceptable services in healthcare segment? For example, like Tamil Nadu health supply chain, which is not something very different from a conventional supply chain. There are few things which are unique to this. For example, you say that how do you forecast for a medical drug? So you need to follow certain characteristics of the product. In this case, the product is a medical product or healthcare product. So you need to understand those dimensions of the demand, then design that. So having said this, what I am doing in my course is that I, being a supply chain and operations professor, I know only one aspect of this healthcare. The other aspect of healthcare that is very much required is health technologies.
Yes.
So I work closely with the startups. What is that they have done? What kind of pain areas that they have digitized? How they are digitized? Then what was the outcome of these things? There's one part, tech part, management part, tech part, and medical professionals. Like, for example, you are a medical doctor. I work very closely with the hospital medical professionals. For example, I have a guest faculty who comes from AIMS Delhi. He is a neurosurgeon and he has his own company also. He comes back and tells that how he has computerized the entire AIMS Delhi. And also he talks about a new product or ventilator that he has developed in collaboration with these people. I would call it as we need at least 3 different stakeholders collaboration.
Absolutely.
Tech, medical and management.
Yes.
Yes.
So I think probably after this discussion, we will probably include at least one definite course on supply chain management into our curriculum. I think it's not yet covered, so I think that's the only area that we need to definitely focus on. But I think there are also a lot of areas to collaborate and a lot more work that we can actually do. So it's wonderful talking to you, Dr. Venkat, and it's actually fascinating to talk about supply chain management, especially related to healthcare in our country. Any best practices that you can actually mention probably as we are closing this podcast that we can probably follow?
In medicine, don't use self-medication. The same thing I would say, take a professional advice.
Yes.
Before you take a pill, is it recommended by the doctor or not? So, you put science into practice. In healthcare, if you put management science or supply chain management scientific principles, stick to scientific principles in healthcare.
I mean, maybe a small anecdote that before Tamil Nadu, the medical procurement came, a lot of states were having really funny ways to procure. In fact, like a lot of procurement was done at district level, and then when it was centralized, people would actually buy medicines and then equally distribute it to all the districts, irrespective of the fact that whether they actually need it or not. Equality was actually followed. And then there's also another small anecdote where government actually buys the medicines, and then obviously PHC medical officers need to intend. But there is actually a line item that is missing for transportation from the district warehouse to the PHC, simply because that was not costed for. Most of the medicines will still remain at warehouses, and then it literally rots.
Yeah.
And because of those few hundred rupees or maybe a couple of thousand, people do not actually kind of come to a warehouse and then pay. So, as you rightly said, there's actually a science behind it, and you need to map the workflow. You need to ensure that each and every step actually gets its due attention, and only then the whole system will work. I mean, we cannot actually depend everything on the so-called doctor, or perhaps have this, outlier people and assume that they are going to take care of everything. So there is a science that's actually very well documented, and let's not treat ourselves. Let's just follow what is written and accepted. I think that's a great.
I'll summarize this. One is from what you said. It is, we will recall in our language as a demand pull system rather than push system. Instead of pushing the supplies to the demand points, let the demand points draw what they need. It is called a pull system in operations language. So practice pull practices, number one. Number two, the coordination. Supply chain, one word answer is coordination. If you put the coordination in place, everything will be all right. The third important dimension, as I already mentioned, digital. Without a tech, without digital, nothing will work. Particularly the way the technological implementations or adaptation that is happening. Use technology to improve the existing system response, and also scale up by bringing non-customers into customers.
Yes. Yeah.
I would call it as inclusivity in health is possible.
Only through
one is by digital and connecting the digital with supply chain.
Absolutely.
Digital enabled supply chains can save our country. I have no hesitation in telling this.
That's what
the lifeline of this country is with a digital enabled supply chain.
I think that's what will lead to digital health transformation also.
Yes.
Fantastic talking to you, Dr. Venkat, and it's always a pleasure. So I hope we'll continue working together and then maybe changing the health system a little bit better.
Yeah. And my cordial invitation to you to our campus. And as I already told, IIM system is very responsive, and we will be glad to host you at our institute in course of time. Please accept our invitation in near future.
Well, thanks a lot, Dr. Venkat.